My goal today is to persuade my fellow classmates to practice healthier daily habits so that they can live longer, be happier, and save money. According to the United Health Foundation, Arkansas is 48th in the country when it comes to public health, making us one of the least healthy states in the nation. Due to the current health crisis, I have become extremely passionate about improving the daily habits of Arkansas individuals and hopefully decreasing vulnerability to future disease and illness. For most of us, extra time to cook, be active, or quit an old habit can appear frustrating, time-consuming, and costly. However, improving upon these things can hopefully save you money, benefit your mental state, and possibly even save your life. Today, I'm going to review the most prevalent health issues in the state, promote some solutions to those issues, and discuss direct benefits to those solutions. As I previously mentioned, Arkansas is ranked 40th in the country when it comes to public health. This is due to the high levels of obesity, cardiovascular health, and infant mortality. According to the United Health Foundation, 37.1% of adults in Arkansas are obese, and this is due to physical inactivity and diet or poor general health. 13.9% of adults in Arkansas suffer from diabetes, and obese people spend 42% more on healthcare than healthy weight people, according to the Arkansas Coalition for Obesity Prevention. There was also $342.2 billion in direct medical costs related to obesity in 2016. Obesity can also cause mental illnesses such as depression and anxiety. According to the American Heart Association, in reference to cardiovascular health, it is the sixth highest. We have the sixth highest death rate in the country when it comes to cardiovascular health. It's the number one killer in Arkansas. Smoking has to do with 1/3 of all the deaths, and 22.7% of Arkansas residents are avid smokers. This is extremely high for our country. There's an estimated $1 trillion in direct medical costs due to cardiovascular disease in 2035. According to the United Health Foundations, in relation to infant mortality, the Arkansas percentage for that, or the value, is 8.1 per 1,000 live births, and that's out of 2019. That's extremely high for the country. This is due to unavailable access to prenatal care and information related to prenatal care. It also has to do with low birth weight and birth defects, and Arkansas has about 9.3% of all births are due to low birth weight, and that makes us about 42nd in the country, so it's pretty high. It also varies by county, so the eastern and southern areas of the state have higher rates of infant mortality, and this does correlate with the poverty levels in those areas, and according to the Minority Health Commission of Arkansas. Now that you've heard some of the terrible issues Arkansas citizens go through daily, what can we do to improve? So some of the solutions include diet, exercise, changing your health routine, following medical advice, community outreach, very, very simple things. So if you can't figure out how to stay physically active or physically healthy in such a cautionary time or even on a budget, outdoor activities and grocery delivery services make healthy options extremely simple. Arkansas, especially Northwest Arkansas, has a vast amount of trails, parks, lakes, including Devil's Den, Buffalo River, Beaver Lake, Mount Kessler, Hobbs State Park, etc. Take advantage of the state's vibrant nature scene, and all of this is free. Getting out, being active is a great way to promote physical health. Another way to promote good diet health would be through online delivery grocery services like Instacart. Instacart is an online delivery service that works with local stores to deliver groceries to your door, and it provides coupons to products and fresh produce. All you have to do is type Instacart into your search browser, enter your zip code, and you're on your way. Cooking from home is way cheaper and healthier because you can control your portion size. There is a small delivery fee. However, the company does provide coupons to all these items, so it kind of compensates a bit for that. So in regards to cardiovascular disease, a lot of that has to do with smoking. So if you can't get smoking, a great way to at least start your journey onto that would be to change up your daily routine. Identify which parts of your routine triggers your urge to smoke and introduce a new element that takes its place. For example, if you smoke directly after a meal, try integrating a new activity immediately after eating, like taking a shower, going for a walk, doing the dishes. This is a no-cost treatment and very simple to implement. Avoid areas and times in your routine where you used to smoke. You can help this by removing indicators like ashtrays and lighters around your daily area. Again, it is a lot of these programs to get you to quit smoking are extremely expensive and time consuming, and this is a very simple, free thing you can do to just ease your way into it. If you don't know how you can help to reduce infant mortality, it's actually very simple. I know it sounds kind of scary. Infant mortality is a very serious thing, but there are lots of ways we can do to help improve that for our state. By supporting your local businesses and being informed to programs that increase access to prenatal care, and by volunteering in low-income communities. Websites and organizations like Planned Parenthood and our community health centers provide helplines, tips, and locations for expecting mothers and places they can go for guidance. They inform them on safe lifestyles while pregnant, and you can promote these things through social media or just word of mouth. The University of Arkansas Medical Science Clinics also provide a 24-hour call center, a statewide telemedicine network, and emergency care through the university. Being knowledgeable about these services does not hinder you in any way, and just knowing about this and being able to talk to someone else about it really, really helps the community and it really can help people out. Providing assistance to low-income areas reduces stress on their daily lives and allows families in these areas to focus, especially for prenatal care, focus on their child. Using feedingamerica.org, I found our local Northwest Arkansas food bank located at 1378 June Self Drive, Bethel Heights, Arkansas. And I have this address here for you guys to use as well. What will you guys get out of this? I've been talking a lot about all these great solutions, and you guys are probably thinking, what am I going to get out of this? Well, some of the benefits that you can have by implementing some of these solutions would be living longer, being happier, and saving money. Increasing your daily activity and making smarter diet choices can reduce your risk of threatening health complications, and feeling physically healthy can correlate to a positive mental state and improved mood. With improved overall health, individuals and states will spend less on healthcare, and available access to medical care leads to longer and safer lives. The changes you can make are simple yet extremely powerful. Today, I've discussed what causes Arkansas's public health to be so damaging to the state's well-being and provided solutions to improve upon the longevity of life, finances, and mental health. 48th in the nation is not an accomplishment. Go for a hike, make dinner at home, volunteer, take the initiative to improve your individual health and knowledge of healthcare strategies so that we can pass these habits onto future generations and not only improve the health of the state, but the health of the country. Thanks.